the key event that we're going to present today. Okay, guys, it is my duty and it's my responsibility, but I'm going to tell you right now, it is my honor to present these three gentlemen who are the crux of what we are doing today on the murder of John F. Kennedy. Now, I'm not going to introduce all of them, but I'll name them as they come up here, and then I'm going to turn it over to Professor Horne in just a few minutes. Okay. We have a panel of three individuals, and I'll mention their names, but then, like I said, I'd give it over to Professor Horne. Doug Horne will come up here, and he'll bring David Mantik with him, and also Dr. Mike Chesser, Dr. David Mantik. I'll make sure you get doctors in both of those. And I want to let you know that if you haven't read some of the books out there that deal with medical terminology and technology, these people are the people to ask the questions, and if you don't understand something, save it, write it down, and they will try to answer those questions for you. So, it is my pleasure to introduce to you Dr. David Mantik, Dr. Mike Chesser, and Professor Doug Horne, who's going to do the introductions for these people. Please welcome those three individuals.
Hello again, everybody. Casey, that's Herr Professor Horne. Okay. If you insist on joking, we might as well do it right. Okay. Folks, I'm assuming most of you were here yesterday for my presentation on the skull X-rays. These are the two gentlemen whose work I was basing that on. And now you get to hear it from them. I've asked them to give abbreviated presentations compared to what they might normally give. Because after that, we're going to have a panel discussion amongst the three of us, which I think you might really find interesting, because nobody agrees on everything. So I'll be putting up, after David Mantik presents his presentation, after Mike Chesser presents his, I will put up autopsy photographs and some other materials, wound diagrams, and Dr. Boswell's sketch, and we will have a three-way discussion back and forth about what's wrong with some of those images and what they mean. So I hope that's useful to you. So without further ado, I'm going to introduce Dr. Mantik. I first saw Dr. Mantik give an address in 1993. That was my first JFK symposium. It was the ASK symposium on the 30th anniversary here in Dallas in 1993. I was really blown away by his presentation on the possible alteration of the skull X-rays. He wasn't really sure yet. He was leaning in that direction, but he gave all the data that he had. It was a great presentation. And then he kept giving them the next 2 or 3 years, and then by that time he was certain, but it was great to see the evolution of his research. So here we are together years later. Dr. David W. Mantik has a PhD in physics from the University of Wisconsin, and he has an MD from the University of Michigan. He completed his internship and residency in radiation oncology at the Los Angeles County USC Medical Center in Los Angeles. He is still a practicing radiation oncologist. I believe it's his 4th decade of practice. Is that right? Okay. He's had 9 visits to the National Archives to view the autopsy materials. On different occasions, he viewed different autopsy materials, but I'm talking about the photographs, the skull X-rays, the other X-rays, and I'm sure he viewed other items of evidence when you were there too, the magic bullet and whatnot, and bullet. Zapruder film. Zapruder film, excellent, okay. So his 9 visits to Nara there were 4 of them in 1993. He was very busy. There were 2 visits by Dr. Mantik in 1994. There were 2 more visits in 1995. And there was 1 final visit in 2001. So I invite your close attention to one of my valued friends, a good friend, David Mantik. Thank you.
Just in the last year, Jerome Corsi and I have published the final analysis. And the year before that, I self-published the hardcover book On the Screen. These are both available on Amazon. And if your bank account is low, they can be purchased with Kindle. So here's the official photograph of the back of the head with the famous red spot. This red spot was not seen at the autopsy, nor was it seen by at least 16 Parkland doctors. Here's the infamous 6.5 millimeter object not seen at the autopsy. The pathology doctors were unanimous in this. No one else at the autopsy saw it either, even though these x-rays were placed on a public viewing screen in front of dozens of people. No one spoke about it. The only reason for taking these x-rays was to locate and remove metallic objects like that 6.5 millimeter object. So we're talking about that. The most obvious, apparently metallic object in all the X-ray films. No one saw it. And it's not in the National Archives. It has never been there. Now here's the problem. On your right is the same anterior-posterior view of the skull I just showed you in the previous image. On the left is a photoshopped image, which I think is close to what the pathologist actually saw that night. Oops. The 6.5 millimeter object was not there, as they said. Instead, there was a tiny sliver of metal, something like that. They did not remove that. Instead, they removed this one, which is at the front of the skull. They never removed this one. The official case was based on these 2 items. The red spot and the 6.5 millimeter object. Neither one was seen at the autopsy. The 6.5 millimeter cross-section is not in the National Archives. It has never been there. It's a total fiction. How can an entire autopsy report fully rely on 2 invisible items? Later government experts misled us. The HSC Forensic Pathology Panel trusted the photographs. They totally ignored the autopsy pathologists. The panel was not told that there was no provenance or chain of possession for the photographs. They did not know, they were not told that the camera did not match the photographs. Here's another myth. They all believed that X-rays were as immutable as God himself. That was not true. Of course, the real problem was that they had never actually worked in a darkroom, so they did not know how X-ray copying was done. The white patch is another clue to X-ray alteration. On your right, you can see where I've outlined the white patch. That's very obvious in prints, and I proved conclusively with dozens and dozens of measurements through via optical density at the National Archives that this white patch is totally unlike any normal human anatomy, dead or alive. On the left, we have the pre-mortem skull X-ray of JFK, which was taken for dental purposes. There is no white patch on that. And Mike Chesser at the Boston Library took optical density measurements in that same area and showed conclusively by measuring that there is no white patch before he died. The white patch only appeared after JFK died. To me, this is the most powerful incrimination of all. On the official X-rays, there is a T-shaped inscription, as shown here. Unfortunately, JFK's X-ray that shows this is not in the public record, so I cannot show you his X-ray. This is an anonymous patient. Under this inscription, in the film emulsion, no X-ray emulsion is missing. Why is that important? In order to create that T-shaped image, the emulsion on the film would have to be scraped off. You could do this with your fingernail, or a nail, or a file. I do not know why this was done. We will never know. The X-ray technologist may simply have wanted to put his "I was here" sign here. It doesn't matter. Its purpose is irrelevant. The point is that the emulsion was scraped off. Well, supposedly it was scraped off. When I was at the archives, I asked Steve Tilley to take this film out of its transparent plastic enclosure so that I could see directly on this surface. There is no emulsion missing anywhere on this film. It's all totally intact. Mike Chesser can concur with that. What does that mean? It can mean only one thing. This is a copy film. The copy film would have registered honestly what was on the original, but the copy film had no emulsion scraped off. So it's an inevitable, irrefutable conclusion. That particular film in the National Archives can only be a copy. Where is the original? The archives claims this is the original. Steve Tilley confirmed this to me afterwards in a letter. Unfortunately, I don't think Steve Tilley ever read any of my work. Doug Horne concluded in 2009 that there were 3 successful headshots as shown here. In 1996, Roy Schaefer, to my knowledge, was the first to propose 3 headshots. I still have the videotape in which Roy Schaefer presented this, but he made a few significant errors, so he cannot receive credit for this. It's Doug's credit alone. We now know that the pathologist overtly lied. After they reviewed the autopsy materials in the 60s, they prepared this report, and I've highlighted the critical line. No evidence of a bullet or of a major portion of a bullet in the body of the president. This was after reviewing this x-ray. Do you see a major portion of a bullet in this x-ray? A kindergartner would see it. But they didn't see it. They said so in the official record. They did not see this. Yeah, this is what they looked at. Regarding the magic bullet theory, this is actually where T3 is located. There's no magic bullet possible at this level. And we know that Admiral Berkeley signed the autopsy images and report indicating that it was at this level, maybe even T4. Here's Paul O'Connor's sketch. This is surely not consistent with the magic bullet either. Now, Paul O'Connor said this was a very funny autopsy. Paul had seen a lot before this. Boswell and Humes told him to go outside the room where he was guarded by a Marine while he was out there. He remained outside for approximately 30 or 40 minutes. How many of you knew that? Could I see hands? Please, put your hands up. How many of you knew that Paul O'Connor was under Marine guard so he could not see what was happening inside the autopsy room? Hands up. 2 people knew this, plus a few in the audience. But what was going on? He's the first assistant to the pathologist, and they kicked him out of the room for 30 or 40 minutes under a Marine guard. What point is served by not having your assistant at the autopsy? Can you imagine what they might have been doing during this time? Well, I was able to show eventually, using techniques readily available in 1963, that you can alter X-rays, as I showed here. On the right is what I called my bird brain. And on the left, that's not a case for a lawsuit because that's not a real metallic scissors. Metallic scissors would have been white. Somebody actually left an air scissors inside this skull. Can you imagine? Now, here's a very tricky point that unfortunately many of my fellow researchers still don't understand. There were 2 frontal shots, as we showed in the image before. One of them came in the forehead, and you'll hear more about this from Dr. Mike Chesser. But there was also a shot into the right temple, and Mike may also talk about that. But these 2 shots from the front are often conflated and assumed to be a single shot. They are not. They're 2 separate shots, distinctly different. And here's the side view. So we're going to take a minute here to try to digest this. The blue line near the top is close to where the frontal shot entered, high in the forehead, and it was obscured by JFK's hair, so very few people saw it in Dallas, but some did. Charles Crenshaw saw it. And it led to the trail of metallic debris that Mike Chesser will show you in detail in a bit. But the other shot, the purple horizontal area, entered just in front of the right ear. And Mike just conversed earlier today with James Jenkins, who saw the entry hole consistent with this shot. This is much lower than the blue line. There are totally different vertical levels. Now the red line represents the third headshot. That's the one that came in from the back that the pathologist identified. I agree with them that there was one there, and they probably identified the correct site. And Mike can tell you his story about what Humes and Boswell did with the entry site for this purple arrow that came in the right temple. That is the shot that probably produced the large hole in the back of the head. The blue arrow did not, because we can see the trail of debris on the x-rays. It appears to end before it exits the skull. But the purple arrow is totally consistent with a huge blowout in the back of the head. So to summarize, two frontal shots, distinctly different from each other, but confused by many people, including some of the Parkland doctors. And so I hope we don't have to do this one again. Here's another view. At the very top is the trail of metallic debris. That's from the forehead shot that came in very near the hairline, just at the top of JFK's forehead. And you see what purports to be an autopsy photograph with that from the two following speakers as well. Other eyewitnesses saw autopsy photographs consistent with that. But the huge blowout of the back of the head blew out the Hopper fragment, shown crosshatched here. This is at a much lower level. So do not confuse these two frontal shots. This one came in the forehead. The shot that blew out the back of the head came near the right temple in this area and blew out this area. So for comparison, as a control, I did a little shop work. I cut off the end of a real Mantik bullet. I bought a real human skull, placed the real cross-section of a Mantik bullet on the skull, and that's what it should look like if it's really at the back of the head. And here it is on the frontal view. Now, the optical density of that 6.5 millimeter object on JFK's X-ray, not this one, on JFK's X-ray, is so translucent that it can only mean that the piece of metal was this long if you took it on the lateral X-ray. It should be that long. And we know that from all my measurements, plus we also know it from a control with JFK's dental amalgams, which were composed of mercury and silver, on the same X-ray. On the frontal X-ray, I did the measurements front to back on all these dental amalgams and compared them to that 6.5 millimeter object. Perfect control. That's what it should look like on the lateral X-ray. Is that what you see here? No. There's something wrong. What you see on the AP X-ray with that 6.5 millimeter object is a fake that was done in the darkroom after the autopsy. That's why no one saw it at the autopsy. And since I was able to prove that you could, using 1963 techniques, we know quite well that it's not real. Here's a CT scan of a patient of rather similar size to JFK. And if the bullet came in the back, that's on the lower right. Here I placed it at the distance from the midline as reported by the pathologist, and they reported that the wound in the throat was about the midline. So if it followed a straight path, that's what it should have done. It should have fractured the vertebral body. The X-rays show no such fracture. There was no such trajectory. It was all fanciful. Notice the location of the telephone here. on the wall in the background. Also notice the narrow tiles just above JFK's forehead. They're not all the same width. Rydberg did a sketch of the morgue. Notice where he placed the phone. Is that consistent with the autopsy photograph? Look at these two images. So either Rydberg was totally stoned, or somebody messed around with the autopsy photographs. You have to choose. An intact bullet was found at the autopsy. And jump straight to the bottom here. Notice that the magic bullet was at the FBI. We're not talking about the magic bullet. This is another bullet. The following 6 individuals all recall an intact bullet at the autopsy, not a fragment. This is not the 6.5 millimeter fragment. They saw an intact bullet, a whole bullet. 6 people, Young, Mills, Martinell, Stover, Osborne, and Custer. Stover was the commanding officer of the medical school. Osborne was chief of surgery at that time. Later, Rear Admiral David Osborne reported that he had held that bullet in his hand that night. He was not believed. Admirals are not to be trusted. He later served as Deputy Surgeon General of the Navy and then the commander of the Bethesda Naval National Medical Center, a phrase you all know. But Osborne was apparently forgetful and senile when he remembered this bullet. On my last visit in 2001, I saw something I had never seen before in the autopsy photographs. There's a dark spot on the left side in the back. It's forensically irrelevant. Don't ask me what it means. It's probably just a clot of blood, and that's not my focus. My focus is its photographic characteristics. Each one of the photographic images comes in a pair. 2 successive images were taken by the photographer so that you could perform stereo viewing of each image. So the image you're seeing here has a partner image, which I cannot show you because it's not in the public record. However, on that partner image, that dark spot looks like this. It has totally transformed. It's lighter in color, and somebody drew a horizontal black line through it. This is only my approximation from my memory. Of course, I cannot show you the original. Did someone do this artwork on JFK's back between the 2 photographic exposures? Or does this more likely represent a relic from photographic manipulation? If this is indeed a clue to photographic alteration, then the door is wide open. You can't trust anything else in this set. Mike Chesser asked to go back again to do another visit, and this is the letter he received from our common bane. No basis for permitting further access. Do not approve of your recent request. I have received a similar notice. Mike and I are both outcasts, permanently banned from the National Archives. We know too much.
David, may I?
Yeah.
David, Hello? Okay, good, thank you. David, can you explain to us who the current, or at this time, who is the guardian of the JFK, of the access to the autopsy deed of gift? It says Senator Kirk. Senator from what state?
I think he's from Massachusetts. Mike, do you know?
Senator Kirk was, but now those two attorneys in that letter took his place. So there
So
was
Kevin Bain is the attorney.
Kevin Bain in the other name. I didn't catch it, but
Yeah.
Okay, thank you.
Anyway, if you want to visit the archives and see these images for yourself, this is who to contact. I hope someone does. Don't tell them what your purposes are. Here's something to think about. Charles de Gaulle survived more than 30 assassination attempts, possibly including one by Jean-René Suetre, this is Otto Skorzany's hitman and trainer. Suetre was reported in a CIA memo as having been present in Dallas on November 22nd, 1963. JFK could not even survive one supposed attempt by Lee Harvey Oswald, so my question is, why didn't the OAS just hire Oswald? This is my website, and for the moment, I am done.
David Mantik contacted me, I don't remember, circa 2014 or 2015, and he said, I have a new friend, a new colleague, Dr. Mike Chesser. He's received permission to go to the archives and view the autopsy materials. Do you want to go? And I was in one of my frequent periods of burnout on this case, and I said, oh no, not me. I said, besides, they wouldn't let me in anyway, which was certainly true. They would have quickly said, oh no, you were on the review board staff, you've seen the materials many times, you have no justification to come. So I didn't try to tag along, but it wouldn't have succeeded anyway. So anyway, fortunately, Dr. Chesser did go, and he's been 5 times. Twice to Boston, that's part of the NARA system, and 3 times to Archives 2 in College Park. So Dr. Mike Chesser went to medical school at the University of Arkansas. He spent 2 years in the U.S. Navy as a naval. He spent 2 years in the U.S. Navy as a Navy doctor, and then on active duty, and he spent his internship and residency at the University of Arkansas, and his residency was in neurology. Actually, Mike, correct me if I'm wrong, I think your Navy service was in between your internship and your residency. Okay, thank you. He's board certified in neurology and clinical neurophysiology. Okay. I'm impressed by that. That's the person I would want to study brain trauma and skull x-rays. And as I just said, he visited the JFK Library in Boston twice to view JFK's pre-mortem skull x-ray. He visited NARA 3 times between 2015 and 2017. He'll tell you the story, but he viewed the enhanced skull x-rays twice on 2 different visits. He viewed the original, so-called original, unenhanced skull x-rays once, and he viewed on another visit the autopsy photos that the review board had digitized at Kodak in Rochester so that they could be viewed in a different media, in a digital media in extreme blow-up. He's presently director of Neurodiagnostics Department, of the Neurodiagnostics Department at the Baptist Medical Center in Little Rock, Arkansas. It's my pleasure to welcome Mike Chesser. Thank you.
David, I wonder if we could dim the lights some. I want everyone to be able to see the X-ray images.
You can see my images here. Yeah.
First, it's a real honor for me to be on the podium with Doug and David. I have the utmost respect for them, both personally and for all the hard work they've done over the years. And I'd like to thank David Denton and the whole crew from the historical group. I'm really enjoying this conference. I don't know about you guys, but it's been really educational. Before I get started, closer? All right. Is that better? I started to put up my whole resume up there. Like a lot of you, I had about 10 jobs from the age of 14 up to med school. And one job in particular was the hardest job I ever did, was stacking bricks at Acme Brick in Malvern, Arkansas. We stacked 10,000 bricks per person per day. They come out of the kiln, you pick up 3 or 4 at a time, and put them on a conveyor belt. I found out later that Robert Oswald was working there at the same time, but I didn't know it. I didn't think I'd make it through the first day. Then I didn't think I'd make it through the first week. I was glad to finish that summer, but I'm glad I did it because it taught me something that, there's a lot of things that are hard to do, but you have to take it one step at a time. And all the work that they've done, and a lot of you guys have done, it's one little piece of data, one record at a time, and it accumulates over years. And in the short time I've been doing this, just since 2014, there's been quite a bit more information, so, we may not find all the answers in our lifetime, but we've made a lot of progress. This week, listening to Doug and talking with Doug and David, I developed a lot of questions, and I keep pretty close contact with Jim Jenkins, the hospital corpsman for the autopsy. And most of the time we just shoot the bull, and I don't pick his brain anymore because I don't want to bother him too much about that. But he first told me about the right temple wound, or described it to me back in 2015. So I thought I'd ask him again about that. So I called him this morning. This is what he said. He said the right temple wound was the size of his little finger, round, slightly elongated. Sounds like a tangential entry. It definitely had a gray rim, a gray border, which is a bullet wipe, which means entry. It should mean entry. I asked him if they explored that wound any further. He said when Fink commented on the bullet wipe, Humes was called to the gallery. He talked with one of the flag officers, and Jim always thought it was Berkeley, but then recently found out that Berkeley was not in uniform. Jim remembers that this officer he talked with was in uniform, and now he thinks it was one of the Army generals. He remembers a Navy admiral, one Air Force general, and 2 Army generals. A couple other things he told me this morning. About the x-rays. I asked if he remembered anything about the x-rays, when they were taken, who took them, and he said there were 3 sets of x-rays taken in the morgue, and we're talking about the new morgue where the official autopsy was done. The first set, Jim Jenkins said he assisted Custer by holding the cassettes. He distinctly remembers an AP, 2 laterals, 2 obliques coming at an angle, so you can actually separate the left or the left side of the skull from the right. And then he remembers, so that's 5. He remembers one that was angled from below, catching the cervical spine, the neck, and the lower part of the head. He remembers that because they had to use a chest x-ray cassette, and he helped to position it for that. So he remembers 6 x-rays in that set of x-rays. The obliques would have been extremely helpful in getting more information about the head wounds. And we'll talk about that a little bit more. The other thing I wanted to clarify with him was a conversation he had with Dennis David. Jim said he drove over to see Dennis David in New Orleans, and it was not long before Dennis passed away. He had a terminal illness. And at that last visit that he saw him, Dennis told him that Admiral Stover ordered him to change the timeline in the action log for the morgue. Dennis had originally put in 6:38 p.m. He was ordered to change it to 7:15.
That's for arrival of the casket, right? Arrival of the president?
Yes, yes. I had him on the phone. I asked him a little bit more about the autopsy procedures. And I know some about this because I worked as a morgue attendant during medical school, and I helped remove the brain. We have a pathologist in the audience here, Dr. Ken Linville. He could tell you a lot more about that than I can. But he remembered that they unwrapped the head. When he saw the body initially, they unwrapped the head. And when they removed the final layer, there's a lot of matted hair and blood. When he was able to get a closer look, he could see the parietal occipital wound open, no scalp or skull, whole lot of jagged lacerations going across the scalp. Then he had told me this before, but I asked him to try to remember exactly where he saw this. He saw a straight line incision going from this direction, parietal up to the frontal part of the scalp. I think that's just further evidence of the pre-autopsy inspection of the brain and probable removal of evidence. So everyone knows the Horne Commission version of the wound, entry low here, exit in this general area. So that's 1963. 1968, the Clark panel comes along and they change the entry way up here, 4 inches higher. So this is still mind-boggling to me. They said that the pathologist who actually touched the skull, handled the skull, removed the brain, saw the wounds. They said, no, you were off 10 centimeters, 4 inches. So I want to try to ask you to go try to solve this with me as we look at the evidence. First, do the skull x-rays confirm or contradict the conclusions of the Horne Commission? And second, do they confirm or contradict the conclusions of the House Select Committee? If we find evidence of one or more than one shot to the skull and or a shot from the front, that means there's more than one shooter. I think that the x-rays, skull x-rays, as standalone evidence, disprove the Warren Commission and they disprove the House Select Committee conclusions. These x-rays that we're looking at are part of the deed of gift collection. The Kennedy family had to turn over the autopsy evidence in 1965. The deed of gift places this material in a special category. It's not subject to FOIA. It's very strictly limited. You have to have medical credentials to view it, or scientific credentials of some sort, and you have to have a purpose for the visit. I was initially denied. I revised my request to only the skull x-rays and photographs. And I told them I wanted to go for two reasons. One was to take the optical density measurements again to see if they confirm or contradict what Dr. Mantik did. And I also wanted to measure the sella turcica, which is the little cave that the pituitary gland sits in at the base of the skull, because it looks to be enlarged. And I think it is slightly enlarged. So after I gave them that information, they approved me to view just the skull x-rays and photographs. There are probably lots of reasons why the Clark panel and HSCA medical panel changed the entry location. First, the trajectory didn't fit the Warren Commission scenario. It should have blown out the face. If it entered here in the lower occiput, it should have come out the face, blown out the face. The x-rays did not show a fragment trail from low occiput to exit site. The autopsy photographs, and this was probably the big one, autopsy photographs don't confirm the Warren Commission scenario. They didn't see an entry wound in the lower occipital scalp. Plus, the brain photographs at the archives reveal a cerebellum that's fully intact. And all of them knew this. Dr. Petty talked about it, that an entry at the Warren Commission site should have caused massive injury to the cerebellum. This is Dr. Ebersol and Custer and Reed. So Dr. Morgan, Russell Morgan, here, was the chairman of radiology at Johns Hopkins. He went on to become the president of the American College of Radiology, very respected. So he was on the Clark panel. He looked at the x-rays and he gave x-ray or radiologic backup to their theory that the bullet entered high in the occiput, or actually high in the parietal bone, and exited up here. And this is even more mind-boggling to me. This is 1977 newspaper article I found. What was happening in 1977?
HSCA.
Yes. So he must have gotten word that the medical panel was meeting and looking at the evidence. So he says, since the examination 9 years ago, Dr. Morgan is having second thoughts. He says the fragmentation in the x-ray was so severe that one had to wonder if it was a so-called dump-dump hollow point bullet, as opposed to the kind which is found on the floor beside Conley. That would mean either that Oswald was using two kinds of bullets, or that there was another gunman firing from the 6th floor along with him. He couldn't give up the whole picture there. He said he'd be willing to participate in another examination of the x-ray evidence. even suggesting exhuming the body. So these are the images. These I purchased from the archives, the originals, purported originals, and the computer-enhanced images. This is my replication of the left, what's called the left lateral cutoff, lateral X-ray. So I made 3 visits to the archives. My first visit to the archives, I was presented, I thought I was looking at the originals, and probably a lot of you have heard this story. After about 3 hours, I've been looking at the X-rays and taking optical density measurements, and all of a sudden, the Martha Murphy, who was in charge of that section, she comes in and says, she looked pretty mad. She says, you haven't been looking at the originals, those are the enhanced X-rays from the HSCA. So I insisted that they let me look at the originals. So they did. I had to wait, and after lunch they brought them out, so I didn't have a whole lot of time to look at them. Actually, when I was looking at the film of looking at the film to take it out, one of the films, to look at that T incision, we placed it over the lamp, and the edge started to curl. And this is not a hot, real very hot lamp. It's just typical viewing plate. That told me that they probably didn't do their usual procedure. They're supposed to gradually bring it out of the cold storage, let it slowly warm up, and then go back the same way to try to preserve the film. But the edge started to curl, and they immediately stopped, and they took the X-rays back. So when you're looking at X-rays, for each point on this X-ray, you're looking at all the accumulated tissue from front to back on the AP, and same for the lateral. And here's my replica of the lateral cutoff. I won't go into the explanation for that, or whether or not I believe Custer's explanation. This is the computer-enhanced image. At first, I thought these were films, but they actually printed these images at the Aerospace Corporation. They printed them on transparencies, and I was able to see these twice. There's the so-called white patch. The X-ray techs were off at the angle of the X-ray of the AP. Instead of coming straight on, they were, as you can see, they were going at the wrong angle, and it makes it a little bit more difficult to match up the AP and lateral when you compare sides. So this is with adjustment for the angle of the AP. So you can see the Petrus ridge here, see it there. Sometimes it helps to look at these images in the negative. You can sometimes pick out things and see it a little bit better detail. This is one of the burn marks where Dr. Ebersol supposedly held the AP film up against a hot lamp and it burned it. 40 years of medical practice, I've never seen a burn mark on an X-ray. Have you, David?
No.
So we kind of doubt that explanation. This is the negative of the lateral. I think you can even see the white patch in even more detail here when you look at the sharp outline of the upper border of that white patch. You don't see a natural structure like that right there. When I took my optical density measurements on the left side on that cutoff film, I was able to compare this area with the Petrus Ridge, and this part of that white patch was more dense than the Petrus bone, which is impossible.
That was on the left lateral?
Yes, or the cutoff lateral.
On the one that's cut off,
Yes.
which is also has the T-shaped inscription, right? The left lateral, yes.
Yeah, okay. Now, if you compare the 1960 lateral skull X-ray with this, and this took me a long time to find, but finally they found it at the Presidential Library. It was labeled as a sinus X-ray, actually. So I did the optical density measurements on this. So here's the Warren Commission scenario. They said the Warren Commission report, the X-ray report, only said that there was a fragment trail going from this area up here. Is that correct?
No.
No, not even close. Again, no fragment trail, all of its way up here.
Mike, to amplify that,
Yeah.
at his deposition, Jeremy Gunn asked Dr. Humes, why does the autopsy report say there's a fragment trail from the entry site near the EOP, low in the head, to your indicated exit site in the right front of the head?
Yeah.
Why does it say that when it isn't in this image and the fragment trail is clearly somewhere else? Humes looked very embarrassed. He had no explanation.
There is no explanation. Okay, this is another piece of evidence against the Warren Commission scenario. That little fragment that's embedded in the scalp, how can a bullet entering here, exiting here, cause a fragment which migrates through the scalp 4 inches up to the upper part of the back of the head? It can't. Fragments embedded in the scalp are almost always associated with an exit wound. Rarely, you could have an entry wound cause a fragment embedded in the scalp. But again, this is what, here, we'll talk about that in a minute. That fragment in the scalp, how do we know that's what it was? Well, even the HSCA radiologist said that's what it was, a fragment embedded in the scalp. So here's the fragment trail way up here, so again, it doesn't fit the Warren Commission. There's this wound here in the right temporal bone, which has all the characteristics of either an entry or exit wound. If the bullet exited here, how could it cause this wound here? And this could not be caused by a small fragment. What we're seeing here in the right temporal bone had to be, it's large enough, it has to be a full intact bullet. Now this is what they call the HSCA entry. See where the skull overlaps? So this whole portion of the parietal bone was lifted up and separated back here, and they said this is a hole. That's not a hole, that's not an entry, it's not anywhere close, it's just overlapping bone. So that's what they called the entry, and then they said it exited here. Again, you cannot explain, even if that were an entry, it would not cause a fragment which would migrate down through the scalp, down below the wound.
And Mike, one of our 3 consultants at the review board to help us on the staff understand the evidence was a forensic radiologist, Dr. Fitzpatrick. He insisted that is not an entrance wound, which means Dr. Morgan got it wrong.
Yeah.
And then Michael Bodden, when he piggybacked on Dr. Morgan, he got it wrong.
Yeah. So what about the fragment trail? Does it fit the HSCA scenario? No, it doesn't. You really don't see a trail of fragments from this entry to this exit. It extends from here mostly superior, a few fragments down lower. This definitely disproves the HSCA entry. This fracture, which undoubtedly occurred when this part of the skull bone lifted up, that fracture stops when it encounters this fracture. These two fractures are what you call radial fractures, and they're the first fractures that form when a bullet high velocity hits the skull, and they spread out. Entry radial fractures are the longest fractures, and exit fractures are shorter because there's not as much energy. So this fracture stops when it encounters fracture A. A fracture cannot propagate over open space. So this occurred first, and I think it is evidence of an occipital entry. This occurred second. Again, this is the area of the occipital entry. We're going to be looking at this a little bit closer. So before I went to the archives, I really didn't know a whole lot about the medical evidence. I mean, I'd only read the JFK and the Unspeakable the 1 year before, and I went to a conference, and a lot of people said, you know, we need people to look at the evidence. So I thought, oh, okay. I had family living in the DC area. I'll kill two birds with one stone. But I was first interested in this fragment trail, and second, those two bulges in the frontal bone. Now you're seeing two lines there. The whole right side of the frontal bone had separated from the remainder of the frontal bone. It had separated and fallen backwards and into the skull vault. So that causes a separation. This is not the inner table and outer table of the skull, because when you look at this on the actual images, x-rays at the archives, you can see the inner table and outer table on both of these areas. Again, the fragment trail seemed to expand outward. Now, fragments, when a bullet impacts bone, a lot of things can happen. In general, the larger fragments are going to travel further into the whatever substance it hits, and the smaller ones will be closer to the entry. A lot of different factors, though, as far as the contour of the skull, the bone, and so this is not a 100% rule, but it's just one part of the puzzle in trying to figure out an entry versus exit. So I took two different magnifiers to look at this area a little bit closer. Those two bulges are not natural. They're not present on his x-ray from 1960. So this is like like Doug Horne said, Professor Horne pointed out, there were, I don't know how many, there could have been 50, 75, 100 tiny metallic objects. Now, anything that small, you're not going to see unless it's incredibly dense. A small bone fragment, you're not going to be able to see on an x-ray. So you see a lot more in this part of the fragment trail. Remember, this part of the bone had dropped down. This area was probably initially up here, and when the bone separated, it changed position. Then I saw these. They were clustered just inside this gap in the bone. These are two metallic fragments. They're kind of interesting. They're flat, completely flat on the anterior side. But this is what really caught my attention, because you can't see that on the x-ray images put in the House Select Committee report. The Army did this study back in the late 40s, I think, looking at how far different size bullets or metallic spheres would travel into gel ballistics, and you can see where the larger objects traveled further, and the smaller the sphere went further into the gel ballistics. This is an example of a gunshot wound to the face. You can see when it hits the facial bones, you had fragmentation, and then when it hits the base of the skull here, you have further, more small fragmentation, and then these large fragments go to the back. So again, this is the location. And Doug showed this slide yesterday, and this is what I saw there. This is, I didn't measure this with optical density. David Mantik told me that this measures, definitely it was metallic. This was not that area. Now use this with your photo program. You can change the contrast and enhancement, or contrast and brightness, and see what happens when we do that. The two bulges melt away, and you can see where the lower one is obscuring that gap in the bone. There's no beveling that you can see on this image that you can say with 100% certainty that it's an entry, but everything else points to an entry. We're catching a lot of, with this cross section, you're including a lot of the normal part of the skull. You're including fractures that are radiating out to the side. This is the radiologist who was in charge of enhancing those x-rays. Dr. McDonald was Army medical officer in charge of animal nuclear toxicity testing. In the desert back in the 50s, they would put pigs out in cages, different distance from the explosion, and watch what happened. During that same time, he was going around the country they had a program where they were trying to convince people, hey, there's no reason to panic here. You know, you can survive a nuclear blast if you do the right things. Now, he really was part of that effort. So he was the one that was chosen to digitize the x-rays at the Aerospace Corporation in California, which is a quasi-governmental agency that supported Defense Department, CIA, and NASA. This picture was taken, or this advertisement's from 1963. At that time, he was teaching defense medicine at UCLA in California. You can see the fragment trail here. And this, if you adjust for the angle of the AP, this is where the fragment trail is on the AP. This is the mystery photo. Okay. At the archives, I was looking at this, and I commented, I said, well, I can see the eyebrows, I can see the eyelashes. And one of the personnel, archives personnel, a woman, was there, and she says, that's what I've always thought it was. She wasn't allowed for any more of my visits. I mean, so you can see the V-shaped incision here on this photograph, and you could clearly see on the color photographs that this is that part of the V incision. Eyebrows, eyelashes up here. So this is the forehead. This is the back of the head. This is the posterior fossa. That is what looks like the bone, a part of either an entry or exit. Hume said when they pulled the scalp apart to take this photograph and then spread it out, bone fell everywhere. Some of it went to the table, some of it fell into the cranial vault, and that's what you're seeing. So the brain's already been removed here.
Mike, can you go back and confirm where the Harper fragment would fit in that?
I'm sorry, yeah. This is, you can see the curvature of the skull very easily on this photograph of the archives. So this area, see that little projection there? It fits the Harper fragment, and that is, so you're looking at this part of the skull. 3 pathologists in Dallas identified as occipital bone. I believe them.
Correct. Spoken to one.
The frontal shot would have been in this area, somewhere along that plane, and obscured by hair. This is photographed from 2 days before the assassination. Another issue, you can see in all the color pictures of President Kennedy, he's got this distinctive auburn kind of reddish hair. It's exactly the hair that I saw on the photographs. The autopsy, I never had any question at all that's him. So these are witnesses to right forehead bullet wound, and I think y'all covered these earlier. And David and Doug both talked with Quentin Swint, and I briefly talked with him, but.
And maybe I should elaborate on the one thing I didn't cover. Thomas Robinson was interviewed by the House Select Committee in 1977. He recorded it, so then they recorded it. That's the only reason they did. So then they created a transcript, and the transcript shows him saying, describing the forehead bullet. He doesn't use the right language. So he was kind of an unsophisticated person, just in terms of language. I mean, it doesn't mean he was stupid. He just, he called it the temple, but then Andy Purdy clarified, and he says, you're putting your finger on the forehead, up near the hairline, and Robinson goes, yeah.
Yeah, they all said it was above the eyebrow. Okay, I think this part of I think at least this one slide showing this ejection of matter above the head, I think that's real. I can't be sure. Now this I agree with Doug that this is really bizarre looking, and it certainly could have been part that was altered. When a bullet travels through the skull, there's a huge wave of pressure that builds up, and you get this temporary cavity. Now, the skull is already weakened because of this occipital wound. You've got fractures coming around. The skull's weak, so what happens? It's going to explode somewhere. His head was tilted, so when it exploded, stuff went that way. That's what I think happened. Now we'll go look at the temple. Now I didn't notice this next part at the archives. This area, I'll go a year sometimes without looking at this stuff. I get burnt out on it, and I can see why Doug got burnt out. But then a few years ago, I thought, I want to compare the AP and lateral, see if I can get more information out of these images, the digital images. So I started looking at this area. Here's a close-up. Okay, this is bone. There's either missing bone or this area is covered up with something, okay. This is a smooth defect in the bone right there. It's not normal. It wasn't on the 1960 X-ray. It's not quite as obvious to me on the enhanced film as it is on the original. This is the original image from the archives. This is the enhanced. This there, that's part of that bone flap that was hanging out.
Mike, could you back it up one, please?
Yeah.
You see the silica turcica on the 1960 X-ray, you don't even see it on the one on the left.
Yeah.
Maybe it's darkened. Just like the metallic snowstorm was darkened out.
That's what I suspect too. Now, this area of the skull is the thinnest part, the temporal bone and the sphenoid bone connected here. So it's thin to begin with, but you don't have anything like this normally occur. So even closer look, here's the bone, here's the soft tissue. See that V kind of looking? So that's soft tissue, V-shaped defect in the soft tissue. I think it's probably the path of the bullet has spread tissue, okay? And there's lines, those are grid lines, those are normal. You can see Ebersol's line there, one of the lines that he drew with a pencil. A little bit different brightness. You can see a little bit more detail. One thing that notice as I adjusted the brightness, you could start to see little bone fragments, kind of oval fragments. And I saw three, I could see these really well on my computer at home, but three bone fragments in the vicinity of this wound. And I think this is a keyhole defect. And we're catching this part, okay? Depending on the angle at which the bullet strikes, the keyhole part can be really prominent or it can be short. So I think this is the keyhole part there, and then the larger bone defect. This is, now, just looking at the x-ray, you can't tell whether this is entry or exit. This is a report of an exit keyhole lesion. Look at that soft tissue or that scalp lesion, V-shaped. But usually keyhole lesions are associated with entry wounds and not with exit wounds. This is the exception. Looking at it again, and there I outlined the bone defect and the soft tissue defect. So when I saw that, I had already done this and compared this to the same part of the skull on the AP. And there you can see it on the enhanced. So we're going to take a closer look at this area on the frontal view. So what do you see here? There must be more than a dozen little white blobs. Those are bone fragments. They're not dense enough to be metallic or bullet fragments. They are bone fragments. Look at the corresponding area on the left side of the skull. There's a whole lot of missing tissue back here. So these bone fragments are clustered around this lucency area, the less density right in the middle. Why don't we see those on the lateral? It means they're either obscured in that dark area anterior to this wound, or they're covered up by the white patch. And I tend to think it's the white patch was used to cover up part of the skull, missing skull, the open wound, and it was used to cover up bone fragments. If you see a trail of bone fragments, you can say, yeah, that bullet went that way. You can see it with different contrast. Can everyone see that? The white dots.
Yeah, and Mike, question? Those two dark lines,
Those
those are fractures or not?
That is there. These are oblique lines associated with, different bone structures around the
Oh, okay.
orbit.
All right.
Yeah. At least that one is. Now this one, I'm not sure about. I have to go back and compare it. That one is normal. This is a fracture.
Okay,
That one I need, yeah, I'm not decided on that one yet.
okay.
One other thing about this whole area, the second time I was able to look at the unenhanced film, the HSCA enhanced film, not digital, but the film, or transparencies, I saw something I want to point out here. The radial fractures, radiating fractures, and concentric fractures. Radial fractures come first, and then as the skull expands, you get this kind of circular pattern of heaving fractures or concentric fractures. So this was visible, and I missed it the first time, but I saw it when I went back. There's a fracture pointing, so it's in this area. Just looking at it, you can't tell if it's on the left side of the skull or on the right, because remember, you're combining all the tissue in between. But there's a fracture pointing in that direction, and there's a concentric fracture here, which certainly could be a concentric fracture associated with this down here, with an entry at this location. These are the witnesses to a right temporal bullet wound. I've talked to, of course, Jim Jenkins. I've talked to Don Curtis. Don Curtis is an oral surgeon. He was doing, the oral surgeons rotated through Parkland, okay? Don Curtis's chairman, Dr. Robert Walker, told him, he said, Dr. Walker told me the following Monday morning that he did see what appeared to be a bullet hole in the right temple. He well knew a bullet hole. And I haven't talked with that doctor. I don't know if he's still living. And I do believe that x-rays provide at least some support for an entry down low in the occiput because of these long radial fractures. Actually, I think we should look at them. There's a lot, I don't have time to go into why, but these long fractures have to be on the left side of the skull. And I've got images I could show, later if anyone's interested. If you look at the occipital area on the original, purported original, it looks like it is disrupted down in that area. And we talked about Poupet's rule that supports this occurring before anything happening up here. This is on the original compared with that same area on the 1960 X-ray. You can see, on the 1960 X-ray, you could see both of the lambdoid sutures, those little areas that separate the parietal bone and the occipital bone. I could only see one here, and this part of the skull is disrupted. Something's not right there. But you're not, an oblique would have answered this question. An oblique x-ray would probably have shown this. This is the AP on the original. Compare the density of the, this is a combination of facial bones and the back of the skull. Compare the density. You're looking straight back and catching, back here, catching the retromastoid area, pretty thick area of the skull. There is a lot less tissue, a lot less density on the right side compared with the left. So I conclude that the skull x-rays are not compatible with either the Warren Commission or the House Select Committee, and that there is strong evidence for frontal entry, occipital entry. After today's conversation with Jim Jenkins, I feel more comfortable in supporting a 3-shot scenario. I've kind of been hesitant to fully support that because you never, it's harder to accept going from 1 shot to 3. And I think it probably is going to be harder for people to accept that. And they'll immediately just disregard it. They say, boy, that's crazy. My first meeting recalls I was sitting next to Joan Mellon, who gave me some advice of who to talk with. And she was interesting. But she told me, she says, Mike, forget any preconceived notions, just follow the evidence. So I think that's what we've done, is follow the evidence. So this would be a 2-shot scenario. In the entry one here, this would have to be an exit, okay? And entry 2 here would have to been responsible for blowing out the back part of the skull. It's extremely doubtful that it would have had the mass and energy to impact that much destruction back here. So I'm leaning heavily toward this 3-shot scenario.
Especially because of the bullet wipe.
The bullet wipe.
And the temporal
yeah,
area.
you can't explain the bullet wipe otherwise.
And the keyhole fracture.
Yeah, yeah.
By the way, G.M. McDonald, who you quoted, worked at Good Samaritan Hospital, downtown LA. Those of you who know about RFK know that he died there. G.M. McDonald reported a fracture in the temporal bone. That's what you are talking about. He agrees with you. So, you have more evidence for the temporal entry.
When did he do this?
For the HSCA. So you
I didn't know
have the bullet wipe in the soft tissue on the skin, as you just reported from James Jenkins. That bullet proceeded and fractured the temporal bone, causing the keyhole fracture, and then it continued on and caused the big blowout in the back of the head. Bingo, 3 shots.
One thing I didn't cover was, this whole fragment trail behind the head is, it's certainly not a full metal jacketed bullet. I talked with Ken Linville about Vincent DeMaio, the famous neuropathologist. In his primary textbook, he says full metal jacketed bullets never disintegrate into tiny particles, and cause a snowstorm. Then he reversed himself later in the same book and said, except, this is probably what happened, that Lee Harvey Oswald's bullet broke apart at the cantilever, the crimping of the jacket, and then it shredded into little pieces. Ken told me yesterday, something I didn't know, that he was, his mentor was Dr. Petty, who was on the House Select Committee panel. I didn't know that. So, I've tried to get neuroradiologists, other people to go, I'm the only one crazy enough, and Dr. Mantik and I are the only ones crazy enough to go and it's quite a venture, isn't it, David?
Yes, it took me a year to get my first permission. I did want to make one more comment about Dr. Morgan. That article appeared in the Lansing State Journal, and it's cited in my book. With the article, you can actually read it in my books.
Right.
Moreover, the key thing about that retraction, which is what I consider it, is when it appeared. Literally, just before the HSCA made these x-rays public, at that very moment, he retracts. His colleagues had never seen the x-rays before. So they didn't know that he was falling into official trap.
Now, one other thing, why would all these people go along with this cover-up? It's just, I think, this is just theoretical, and a lot of people think this, just like LBJ gave this scenario of preventing World War III, to Chief Justice Horne. That's how he roped him into being on the commission. That could have been passed down the line. The Joint Chiefs, well, I don't know what was going on with the Joint Chiefs, that's another question, but when it came down to the hospital and the Admiral Stover and the pathologist, you know, I was a physician in the Navy. You're an officer first, your position second. You get an order, you obey it just like everyone else unless it's unlawful. And then you better have a really good reason. But they probably were told this, you had to do this to prevent something catastrophic happening. So they weren't part of any broad conspiracy. They were following orders, in my opinion.
Mike, thank you. I want to explain to the audience that this is not a normal Q&A time. This is your standard.
Oh, yeah.
I'm about to take over, and we're going to keep moving because I'm going to put up just images, no more text, and the three of us are going to discuss them.
Can I make one more comment?
Yes, sir.
About following orders. At the very moment that the autopsy was occurring, Dr. Humes was accumulating the last few days of his 20-month military pension.
20 years.
20 years. Yeah, at that moment, he was accumulating the last bit of his 20-year pension. Do you think he wanted to tell the truth and sacrifice that?
Well said, and I will add one comment to that. My friend Beverly Sadowski interviewed Dennis David extensively in 2014, and he told her that Humes was always quite distant from the lower level enlisted men, and Humes was a guy who would follow orders no matter what they were. He said he told her that Boswell, the other Navy pathologist, used to be quite approachable and even somewhat in his own mild way gregarious, and that after the autopsy he withdrew, became remote, and appeared to be compromised, acting as if he was compromised for the rest of his career. That's from Dennis David. And since I'm on Dennis David, I want to point out, bear with me, the importance of what Mike told you when he started. He said he called Jim Jenkins today, and Jenkins told him that Dennis David said, I put the entry time for the president's body at 6:38 p.m. And Captain Stover, the head of the Bethesda Medical School, told him to change it to 7:15. I want you to understand what that means. There's only one motive for that. The Boysian report, which didn't surface until the review board got it, says the president arrived at 6:35. So Dennis David was really corroborating that. That's probably, his time is probably when they set it down, the shipping casket, in the anteroom, 3 minutes later after the car drove up. But here's the problem. Stover would only tell him to change that to hide the fact that the president arrived early before the Andrews motorcade, because the Andrews motorcade didn't arrive until 5 minutes to 7. And then please understand that that car sat out there for 12 minutes and didn't move. The newspapers recorded that. So what's in the car? The empty Dallas casket. Had to be empty because the president's already in the hospital. And the driver, Greer. So after sitting outside 12 minutes, the two FBI agents told us under oath, the review board, we went up to Greer and said, why are you sitting here? Because they knew the Dallas casket was in the car, the ambulance. And he said, I don't know where the morgue is. And they said, well, we get our physicals here every year. Follow us around to the back. And then what happened when they went around to the back was recorded by the House Select Committee. Seibert and O'Neill told the House Select Committee in 77 and 78 that 4 men in suits, Seibert, O'Neill of the FBI, Greer and Kellerman are the heroes of the front seat of the presidential limousine. They offloaded the Dallas casket onto a church truck, a wheeled conveyance, and moved it into the morgue anteroom where it sat. So that probably happened at about 7:15, because that car sat out front until at least 7:07. They would have to drive around to the back, and then Kellerman would have to be found. He's inside the morgue, keeping book on people going in and out. So then Greer, Kellerman, Seibert, and O'Neill offloaded this massive, heavy, but yet empty casket onto a church truck and then moved it into the anteroom, and that's why it was 7:15 that Stover told him to change that time to. Stover, who works for Galloway, it wants to hide the fact that the president arrived early, because then people would say, what were you doing with the body? So that's the importance of that.
Follow up.
Yeah.
Follow up on that. If you can do arithmetic, how long is the interval that Doug just described to you? 6:38 to 7:15. That's 37 minutes. How long did I tell you that Paul O'Connor was held under Marine Guard in the hallway? 30 to 40 minutes. Can you make sense out of this?
Brilliant, brilliant. And when Paul O'Connor went back in after being under guard in the hallway by Marines, he told the House committee in '77 that I asked the boys what I missed, and they said, oh, a bullet was removed from the president's back. There was a bullet fragment lodged in the intercostal tissue between his ribs. There was a lot of bleeding. That bullet was removed. And so there's a fiction that goes on during the autopsy of record after 8 o'clock. And the fiction, the charade, is that, gee, we can't find any bullets in the body. Let's x-ray the body 1,000 times see if we can find a bullet. So Humes is engaging in a dishonest charade after 8 o'clock, trying to find a bullet that he knows he's already removed when Paul O'Connor was outside the morgue. Mike, thanks. Thank you very much. Let's hear it from Mike. How much? Great. 25 to 30 minutes. Okay, so I'm going to very quickly kick off this discussion between the three of us with a bang with something controversial, and we're going to find out what my colleagues think about my layman's conclusion about something. I didn't quite get to finish this discussion yesterday, so with some trepidation, I'm going to finish the discussion I wanted to have yesterday, and I'm going to ask these gentlemen what they think about it, and they may not agree with me, or maybe only one of them might agree with me, but I think it's really important to have the discussion, because you need to engage in independent thinking when you're looking at this evidence. There can be multiple interpretations. So anyway, here we go. So where's yesterday's presentation? Here we go. Okay. Okay, first I have to find the slide, so let me go down like this and find the slide. There we go. Okay, and now I'm going to hit slideshow. I think I know how to do this now. It's different from my computer at home. Oh, so that didn't count, huh?
Go to where it says current slide that you want. Like click on that slide on the left and then
It's going to show the title slide if I click on the slide on the left.
no, the one that had the whole list there, the whole.
Hit the escape, Doug.
Come on up here, buddy. Hit escape. I want to go back to one of the later slides, way down here, of the mystery photo. Keep going. I'll find it.
Okay.
And then you do what you have to do.
Find it now. I'll
Yeah,
do my
yeah.
magic.
Get me going, yeah. There we go.
Okay.
And then, yeah. Thanks a lot.
Yep.
Thank you. Okay. This is the mystery photo. I ended up talking about this yesterday, and I pointed out to you that this is really the top and back of the president's head. It's resting on a glass formaldehyde bottle, or whatever glass bottle that is. It's tilted slightly to the left because what's wrong with the, okay, yeah. What's wrong with the operator? Okay. Anyway, so it's where it says right eyebrow on the slide, that's the right part of the president's forehead. He's lying on his back. The head is tilted to the left on this glass bottle. So Dr. Chesser just went over this with you. And he says, this red incision, clearly man-made, and Dr. Peters of Parkland confirmed that. We didn't do that at Parkland, and that's a man-made incision. Dr. Peters said that in 1988 in a documentary. And in the color, gentlemen, am I right? In the color positive transparency of this, it's bright red, isn't it?
Yes.
Which confirms that this
Yeah.
is this. Okay. So this is the forehead entry site where the entry wound was in the Quentin Schwinn drawing of the photograph he saw, which Dennis David confirmed. And this is it in this picture. So this is the entry site of the forehead bullet. Keep that in mind. Okay, this is a minor point, but as I said yesterday, this is Dr. Chesser's first estimate of the midline of the skull on this head that's tilted to the left. And I think since then he's modified it to, he says, well, maybe it's really about here. And I think Dr. Mantik wants it to go through the notch, but
Yeah, I see the notch on the midline on the AP X-ray.
okay. But the point is, it's the top and the back of the head, right, guys?
Oh, yeah,
Okay,
absolutely.
great. So, I want to talk about this. And this is my conclusion, and then I'll ask my colleagues to comment on it. And if they agree with me, great. If they don't agree with me, we'll learn something. And I'll have something to think about. So, Dr. Humes, in the autopsy report, said there is no evidence of exit on the margin, in the margin of the large defect. So this is the large defect in the top of the head and the rear of the head. And he lied, and he said there's no evidence of exit. He lied as far as I'm concerned. And he said in the autopsy report, the only evidence of exit is in a large skull fragment brought later into the morgue, which presumably came out of the limousine. There were 3 skull fragments. We'll look at that x-ray later. And on that x-ray, on that fragment from the limousine, which is in an x-ray of 3 loose fragments, you can see half of a circle, the suggestion of almost half of a circle, which he said in the autopsy report was external beveling, which would indicate an exit site. So it all fell apart for Humes. This is my conclusion, all of this. It all fell apart for Humes when the Department of Justice review was held in January '67. Fink was brought back from Vietnam on a 20-hour airplane flight. The very next day, it might have even been the same day, they were forced to assemble at DOJ, the 3 pathologists, and look at the pictures, and they were told, write a report which relates the autopsy pictures, which you've already cataloged and made a label on, you've described what they are, relate those to the autopsy report. Because Humes didn't have the autopsy pictures when he wrote the autopsy report. He didn't see them until November 1st, '66. So, my story is somebody screwed Dr. Humes by putting this photograph in the collection, because Dr. Fink saw this, and I bet he went ballistic. And he said, this is external, clearly Fink is the one who would have said this. This is external beveling, another half circle, but it's not in this large fragment that I'm going to show you later. It's in the periphery of the large defect, where Humes already said there is no evidence of exit. So I've had a discussion with David Mantik. It was very respectful, and he reminded me that what looks like external beveling is not always evidence of a bullet exiting. But my counter to that is that it probably usually is, more than half the time. So anyway, it took 6 days for somebody to finish this report that these 3 doctors wrote. So they signed the report 6 days later. Fink wrote this up in a report later. 6 days? And he wrote in a report, the report was prepared by the Justice Department. He didn't say the report was prepared by us. He said it was prepared by the Justice Department. Anyway, I think Fink forced this issue. So in that report, it describes this for the first time as, it describes this for the first time in the 1967 January report, describes it as external beveling, and that it completes the circumference of an exit wound, the other half of which is in the loose fragment, which I'll show you in a minute. And then he says this is in the right front of the skull, which completely contradicts what he said on November 1st when he said this is the back of the head. Humes is a liar and a prevaricator and is a completely malleable person who will say whatever he has to make his superiors happy or to escape from jeopardy. So after the Humes deposition, Jeremy said to me, "What did you think?" the next day. I said, "Well, I heard a lot of lies. I'm just not sure which things he said were lies and which things weren't." And he says, this is an experienced deposition attorney, Jeremy Gunn. He says, "I think Dr. Humes is a great prevaricator." So, later, when Dr. Humes appeared before the House Select Committee medical panel in 1977, they said to him, so this is, and remember, Dr. Bodden wants this to be the right front of the head, which would mean the forehead has jagged gaps in it right here, like a pumpkin at Halloween. Ridiculous. The forehead didn't look like this. And of course, this is the forehead with the eyebrow and eyelashes. So Bodden is wrong, but Bodden wants this to be frontal bone. And he says to Humes, this is in a transcript, "So that's frontal bone, right?" And Humes says, no, that's temporal or parietal. And 20 minutes later, he's got Humes agreeing, "Okay, it's frontal, I'm fine with that." That's Dr. Humes. No credibility whatsoever except with regard to the location of the entry wound in the back of the head. All three pathologists agreed on that, and the radial fractures agree on that. So why am I talking about this notch? If Humes and Boswell and Fink were right in January 67, and that this notch is an exit wound, and the fact that, and Bodden endorsed that, House Committee endorsed that, then I'm going to tell you what I think it is. Remember what I just told you this is? This is the forehead bullet entry site. It went straight back in the skull. I'm going to draw a line straight backwards along the midline. Whether the midline's here or here or here, it's parallel with that. I think this is a 1-inch wide exit site for the largest tiny fragment from the disintegrating forehead bullet. Okay? Because you've seen the fragment trail many times now, and the tiny fragments, like dust, stayed near the entrance wound, and then the larger fragments went halfway up in the skull, and the really larger fragments were high in the vertex of the skull. I think one of those fragments, what was left of that bullet, came out here, and it creates a 1-inch wide exit wound that was not seen at Parkland because Kennedy had very thick hair up here. And this is the Harper fragment. And the big blowout seen in Dallas at Parkland was down here. And the Harper fragment was expelled at the same time as this big blowout occurred. So I just think this is an exit for one of the largest fragments from the forehead bullet. However, I think that most of the energy from that, as I've already said, went vertically into the air, vertically and forward, as seen by Dino Brigioni of the CIA when he looked at the unaltered Zapruder film on Saturday night. And I'll talk about that this evening. So that's kind of complicated, but this is my independent layman's conclusion or speculation, and I invite my colleagues to comment on it.
That's a good hypothesis. So you're saying that a piece of metal exited at that site.
Yes.
Where is that piece of metal in the limousine?
Oh, it would have gone into the air and later gone into the street or the grass.
You don't think it was ever recovered?
No, the fragments in the fragment trail from the forehead bullet, they're all pretty small, and this would have been just maybe the largest one that went farther and then exited through here.
You don't think that was the metal shell of the potential mercury bullet?
Oh, the casing?
Yes.
I don't know. I have no idea. Do you? I mean, maybe.
I think your hypothesis suggests that it was the metal shell.
Wow.
So it must appear somewhere in the limousine or on the street. Where is it?
I don't know. It's a hypothesis.
I called it that.
Yeah, right.
Well, I think I think it could be the exit.
Okay.
We don't know exactly what kind of ammunition that was that hit the forehead. I mean, it could have been one of the typical frangible bullets. It could have been one of these weird hybrid bullets produced by someone like Mitch Warbell, you know, that partly a large, part of it's a large bullet intermixed with a part that would disintegrate immediately. So, yeah, I think it could be.
Thanks, guys. Okay. We're going to look at some of the most controversial autopsy pictures, and we're going to talk about them. Let me make this big. Okay, slideshow from current slide. And then, okay. Yeah. I'm getting there. There we go. Okay, so this, I'm sure my colleagues will agree, this is the most controversial autopsy photograph, even more than the one we just looked at, because now we can orient that. We can orient the mystery photo now, thanks to you guys seeing the eyebrow and eyelashes and the president's nipples. So there's two things wrong with this picture. I think they'll agree with me. You don't see a big exit wound in the right rear of the head. You don't see a big exit wound here, which is what they saw in this general vicinity, which is what they saw in Dallas at Parkland. And this lesion, or whatever it is, was not seen by anybody at the autopsy. And the location for the entry wound from behind, of the shot from behind, in the autopsy report says 2.5 centimeters and slightly above the EOP. So the EOP would have been between the middle of each ear, and 2.5 centimeters to the right would have been right about here. So Boswell, during the deposition, this is fascinating. Dr. Boswell, we asked him, do you see, Jeremy, Hughes was all over the place on where wounds were and what they showed. He was very inconsistent and was willing to say almost anything and change his mind. So Jeremy tried a different approach. He said, Dr. Boswell, do you see the entrance wound in the back of the head that you described in the autopsy report in this photograph? And Boswell immediately said, no. He was very laconic and soft-spoken, but he immediately said no, with no hesitation. Jeremy said, well, where would it be if you could see it? And he took a ruler, and he laid the ruler here, and he said, well, it would be about somewhere right about here. And so my question for you, David, and we don't know why it's not visible, is this not the area of the scalp that when you did stereoscopic viewing appeared two-dimensional instead of three-dimensional?
That's correct. There are two major problems with this photograph. First, where's the blood? If you look at the other autopsy photographs, I don't know that we've shown them here, but a lot of people have seen them. There's blood everywhere, all over the hair. Yeah. Furthermore, if you look at the shirt is literally soaked with blood. How is it possible for such a massive head wound, as we know from the x-rays, to show no blood, essentially the red spot, anywhere else on the scalp?
Yes.
The shirt is literally
it's
soaked
the back of the
with
shirt.
blood.
The back of the shirt is soaked, half of it's soaked
This
in
is
blood.
miraculous.
Yes.
Well, it gets worse.
Right, and if there's no exit wound here, how is the back of the shirt soaked in blood?
Yeah.
Very good.
Yeah. The back of the shirt did not get soaked from the back wound. That was very superficial, shallow. That would never do what we see in the shirt.
Right.
But it gets worse. The real problem is that this is a fake, and we know it's a fake from stereo viewing. Now, you don't have to take my word for it. I have published a paired set of images in my hardcover book, and you can do the stereo viewing yourself. Don't take it from me. If you do stereo viewing using the two pairs, you will see that you cannot form a three-dimensional image from those pairs because the conspirators put the same image in each member of the pair. They should have put a slightly different image in each member of the pair, and then you would have gotten a stereo image. Furthermore, every image from the autopsy comes in a pair. And every one of them shows stereo images. It's only this pair that does not show a stereo image. Does it get any better than that?
Thank you. This pair of what? Oh, here's the photo. Come on, Doug. There we go. This photo is what you see in color positive transparencies, 42 and 43. And so David took color positive transparencies 42 and 43. He asked the archives to lay them out, and then you used your stereoscopic viewer to compare the two, right? And is it not true that you said that in all the other autopsy photos of the other views of the body, they were three-dimensional?
This is a very tedious job. Let me have this.
Yeah.
This is a very tedious job, but I was there 9 times. No one else did this, except Grodin. Grodin agrees with me, by the way, that there is no stereo image at this site. But it's a tedious job to form stereo image from each one of all the autopsy pairs. I did that. This is the exception. Why, only in this view, is there no stereo image?
Thank you. Mike?
I had trouble with some of the photographs. The stereo imaging helped me. With others, I couldn't get my eyes to cooperate. But I didn't have the proper focus or distance. But what I remember, this whole area, of course, the scalp's being pulled over, and this area appeared darkened, and this whole area down low just looked totally unnatural to me. It just looked like it painted in with a fine brush or something.
Which area?
This whole area
Okay.
here.
All right.
And it looks, you could probably get an idea, a little bit of that by looking at the photographs out there on the web, but it's just so much different when you look at the autopsy photographs at the archive. Then there seem to be some structures or images in the background of all this fine painted hair that I didn't have any doubt that it was manipulated.
Thank you.
Yep.
Let me make one more comment.
Okay, and then we've only got like 5 minutes left. Okay.
The pathology personnel made it very, very clear, including Humes. JFK's hair was not washed before the autopsy. That
Correct.
would violate every forensic rule. It was not washed. It looks like it was, though, doesn't it?
Yes. Jeremy kept asking that question over and over, and they said, no, we didn't manipulate any bone fragments or scalp or wash the hair before we took these photos, which is, of course, bizarre. I mean, it's not supported here. So because we've got 5 minutes left, I'd like to cover 2 things and get some comments on them. These are wound diagrams. This is Frank O'Neill of the FBI to the House Committee. Where's the wound? Is it in the top of the head? No, it's in the back of the head. I'm talking about the exit wound. Audrey Bell, Chief Operating Room Nurse. Where's the exit wound? It's in the back of the head. Dr. Charles Crenshaw. Where's the exit wound? It's in the back of the head. It's a little higher than Audrey Bell's, but it's in the same quadrant of the head, the right rear. And this is truly occipital parietal. And here's FBI agent James Seibert to the review board. He first drew it, and then he said, no, I didn't draw it big enough. So then he drew the dotted line. So this is his exit wound, which, boy, that's very consistent with what Dr. McClellan drew for the Paramount Plus JFK, what the doctors saw, which was on last year. And that's consistent with all the word pictures created by the treatment reports on the day of the assassination. They describe the wound in this location. This is an artist's conception of what McClellan testified to the Warren Commission. This is what the artist thought he was saying. And McClellan later approved it, but he didn't draw that himself. Harper fragment, we've talked about it. This is Boswell's autopsy sketch, just very quickly, for those of you who may not know. You see the dotted lines in the picture, 10 by 17 messy. President Kennedy's lying on his back when he drew this picture, so it's only the top of the head. And he told the House committee and forensic panel, and he told the review board that the area of missing bone is inside the dotted lines. Two-thirds of the top of the skull and part of the right side. Now he exaggerated how far left it went. It was left of center line, but it was more like this. But that's incredible, and nobody at Parkland Hospital saw anything like that. So look, what does this mean? They received 3 fragments from the limousine late in the autopsy. The medium-sized needed to be fit into a large cavity in the rear of the head to complete the entrance wound in the back of the head. And only then did they know they really had an entrance wound here. So let's look at the x-ray of that before we wrap this up. Those are the fragments. This is the medium-sized fragment that Boswell had to insert in the large cavity in the right rear of the head of missing bone. And by the way, he confirmed the bone was all missing in the right rear of the head. Hume said it wasn't. Boswell said it was. Boswell was a lot more honest than Hume's. And so he had to insert this at the autopsy in the lower edge of the empty cavity to complete the circumference of the entrance wound. You can even see the notch, I think, of the entrance wound, the upper notch. Because before that, all they had was a portion of a small crater. This is the remainder of it.
Do we have any sizes on that?
No, but it's small. It's, oh, by the way, this is the large fragment, which had the semicircular beveled notch in it, evidence of exit. This is the only evidence of exit Hume's mentioned in the autopsy report, was this. And he lied in the autopsy report and said, well, there's no evidence of exit in the periphery of the huge defect, because he didn't know that photo was going to be put in the collection. Okay, we're almost finished. We are finished. David and Mike, you got a chance for closing remarks. Anything that you would like to close with?
It's pretty clear that the military doctors were operating under strict military control. The question you might think about is who ordered them? We didn't hear Galloway's story tonight. Galloway was the commanding officer of the whole Naval Medical Center, and he was seen driving a decoy ambulance around the grounds of the medical center the night of the autopsy. This is Admiral Galloway. Admirals do not drive, they have chauffeurs. Why is Admiral Galloway driving a decoy ambulance around the grounds of the medical center during the autopsy? He is the same person who insisted on Sunday that Dr. Humes change his autopsy report. Dr. Galloway is not a pathologist. How could he possibly do this? Who ordered Dr. Galloway to do this? That's what we need to think about. Who is above Galloway? Think about it.
Thank you, and, oh, you did.
Do I have time?
Okay, no, not quite. And let me conclude here by saying, I guess there's a camera on for the Zoom people, just a minute. Oops. Well, that thing's kaput, but we don't need it anymore. So I conclude by saying the following. The reason Admiral Galloway got in a decoy ambulance, which Lieutenant Lipsey of the Army admitted there was a decoy ambulance. Everybody knew about it that night. All the enlisted men knew about it. It was common knowledge. He tells the House committee, oh yeah, there was a decoy ambulance, and I was General Wheel's aide. General Wheel was the head of the military commandant of the District of Washington, and Lipsey was his aide. And so he said, yeah, there was a decoy ambulance. Galloway got in that because he wanted the Joint Service Casket Team, the honor guard, to follow him. They did, and they got lost in the darkness, and they didn't return to the front of the hospital for 35 or 40 minutes. And they were profoundly mortified. And so their officer in charge, Byrd, went over and talked to Lepsy and Wheel, standing in front of the hospital, and they said, oh, this is terrible. We lost the vehicle with the casket. And they thought that vehicle had the casket in it. It was another light gray Navy ambulance. And they were told, don't worry, there's a decoy ambulance around here. It's part of security. So that was why Galloway did that. So look, my conclusions are, after years and years of thought and study, is that Doctors Humes and Boswell were briefed by very high authority before the president arrived at 6:35 p.m. in a shipping casket. And they were told, look, I think they were told something like this. Look, we know the president was killed by the communists. We know there was a crossfire in Dealey Plaza. We can't tell the American people that he was killed by the communists. We'll have World War III. It's the World War III cover story again. That's what Lyndon Johnson used, as he said, to recruit Earl Warren, who didn't want to be on the Warren Commission. And so I think they were told the following: you will only report evidence of shots from behind. You will not report any shots from the front or the side, and if you can, you will obliterate that evidence on the body. And that's exactly what happened. So the only two autopsy photographs we haven't showed you, shame on me. It's only going to take 60 seconds. Conference organizers, don't shoot me, please. Please. Yeah. So how do I make this big? There we go. Oh, yes. Okay, so these two horrible photographs, I know they're disturbing. We have to talk about them. The entire top of the head is gone. This confirms that there was post-mortem surgery before the autopsy started at 8 o'clock. Nobody in Dallas saw anything remotely like this. You can see the forehead bullet has been cut out. You can see where the bones are split apart by the bullet that came in here. They're actually split. These are bones. And then this was sawed off. Ed Reed saw Humes make an incision here, get out a circular bone saw right here, and then they said, get out of here, go upstairs. Then they came back down and took the skull x-rays later. So the last one I want to show you is this version. This is the version when Thomas Robinson, mortician with Gawler Funeral Home, was in the review board office in 1996, and he saw this. He got visibly agitated because he had a 50-yard line seat for the postmortem surgery. He said, that makes it look like that's what the bullet did. He said, that's not what the bullet did, that's what the doctors did. And yet the doctors under oath lied and said they didn't change anything on this body before they took the pictures, that this was the way it arrived, and that's BS.
One final comment. If JFK was killed because of a Soviet plot, what do you think would have happened to the DEF CON setting that weekend? Do you know? It remained stable, or virtually stable. Think about that.
All right, thanks, guys.
Terrific panel, guys. Great job.